Your Pharmacy Career Podcast, proudly brought to you by Ravens Recruitment, Australia's pharmacy recruitment agency, spotlights the myriad of career paths available to pharmacists. Your host, Christy Lee Patterson, and her esteemed guests will be sharing invaluable career advice that you can implement at any stage of your career journey.
Hello and welcome to Your Pharmacy Career Podcast. This podcast explores the inspiring journeys of pharmacists in the pharmacy industry. I'm your host, Christy Lee, and today I am so thrilled to have James Buckley with us. James is a pharmacy partner and manager for Live Life Pharmacy in far north Queensland in Port Douglas. And he's someone who's really, truly passionate about improving the lives of patients. And so, James, I'm really excited to have you here. Welcome to the show.
Hello, Christy Lee. Thank you for having me.
No worries. So, James, let's dive right in. You've had quite the journey in pharmacy, but I want to go back to what actually motivated you to become a pharmacist in the first place. And what drew you to this profession?
So basically, how I found it during high school, it's hard to pick subjects and what you like and what you want to do dictates the rest of your life. But my teachers basically said, pick things you like and pick things you're good at. So I thought, I really want to be smart. I really want to help people. I love chemistry. I love science stuff. I want to work in healthcare. I want to do all of those things combined. So then when I applied for university, I put pharmacy and I got it. And I thought, well, I'm going to be the best damn pharmacist I can be.
I love that. That is so great. I love that.
Sometimes you get the cards and you think, okay, these are the cards I dealt with. I'm just going to run with it.
Yep. So when you started studying pharmacy and then you graduated and started working as a pharmacist, was it what you expected or was it a little bit different?
It was a little bit different. I didn't really know what to expect to start with, but I thought when I moved to Townsville to study pharmacy, I thought I'd have to get a job in community pharmacy because that's just what I'm going to do, and literally fell in love with community pharmacy because I thought, I want to do clinical, I want to do hospital. And after working in the stores, I thought, no, this is amazing. We can do so much for these people. And I love talking to people and I love having the relationships with your customers and patients and staff. So the more that I did it, the more that I loved it.
Yep, I can definitely relate to that. I think community pharmacy is really special because you get to see so many different, not just like disease states for different types of people, and it's clinical, but then it's also fun and you can chat to people and you can almost just create your own role as well. And what I mean by that is like you can pick a topic or a disease state that you're really passionate about and then create a service around it.
100%. And sky's the limit now in community pharmacy. People are implementing all kinds of services for what they're passionate about and what their area of community needs. For example, we have some stores that specialize in sleep apnea, some stores specialize in healthcare, and some stores like my own specialize in primary healthcare, tourist pharmacy, and acute conditions. So it's very exciting.
That is very exciting. And just one little point that you mentioned just then, your own pharmacy. So that's a pretty remarkable milestone. You're still pretty young. So to be a partner in a pharmacy, that's really cool. And you also mentioned tourist health. That sounds really interesting. So tell me a little bit about that.
Yeah, for sure. So first, how I became a partner too is such an honor and such an incredible journey. Basically, I found myself aligning with values of a particular company. And I said to them, this is my dream. This is always what I've wanted to do. This is always what I want to be, is that person in the community that people come to. I'd love to be a part of the businesses. So we basically worked really hard and trained up, and an opportunity came up to join the other partners up here in Port Douglas to help run the stores. So that was absolutely perfect for me because I love patient-centered and being in front of the patients as their first point of contact, basically. So, yes, tourist pharmacy. It's funny because people don't often think how complex it can be, but it's time and a place and a need that people have in terms of medications. People come away all the time without their regular medications. They go away, they're doing different activities that they would usually do than at home. So, for example, when they're on holidays, they're going hiking, they're going walking, they're going snorkeling, they're going diving, they're going flying, they're going 4x4ing in the bush, they're going to the rainforest, they're going doing all these crazy things that they wouldn't usually do at home. And as a sense, unfortunately, sometimes injure themselves or develop infections or develop ear infections or respiratory viruses, not to mention when you actually travel, getting respiratory viruses from airports that's just what happens. So everyone comes away, they feel sick. They could have been at their work, working really, really hard, and now they have come away and their body's catching up to them and they fall sick because they've been so stressed, and now they go away, I'm all run down because, well, now I'm on holidays, and it catches up with them. So it's quite interesting. There's a variety of different conditions that we see.
I imagine that. Yeah, I don't know. I was just reflecting when you said that when people on holidays, they do things they wouldn't normally do. And I feel like when I go on holidays, I turn into a different person. I'm like, I want to get up at 7 a.m. and go for a hike. Like, I never want to do that.
I want to do fun things. I want to experience it. Yeah. Eating different food as well, trying different things, drinking, indulging a little bit more.
Mm-hmm.
So you can get a lot of types of adverse reactions to those activities. Yeah,
that's right. Yeah, definitely need to look for maybe the hydrolyte or something to help with that next day.
People come up for weddings all the time, and it's like everything's all concentrated stress and pressure. Oh my God, I've got a wedding and this has happened and my toes got infected and my this and then my that, and it's like, oh my God, it's going to ruin the day.
Yes.
So it's quite interesting what we see.
And I think being in North Queensland, my family actually live in Mackay, but I've never actually lived in North Queensland.
Sure,
but I did do a locum stint both in Mackay and in Cairns.
Yeah.
And even just the difference in some of the conditions that you see in North Queensland than what you would down here on the east coast of New South Wales is so different.
Yeah.
And even just it's a lot warmer and more tropical. So like when I was doing the locum shift, like I don't know how many people were having like fungal infections, ear infections, and even like scabies. So that was like
skin infections. We see all the time, infestations, even tropical far north Queensland tropical diseases like ulcers or impetigo or skin conditions are way more common up here.
I think that's a really good segue into chatting about extended scope of practice.
Yeah.
And Queensland has been leading the way, or North Queensland even has been leading the way in scope of practice. And for those listening, scope of practice, I think it's always going to be a continuum. And so what scope of practice looks like for a pharmacist today is going to be very different to what a pharmacist practice looks like in 10 years' time.
Yeah.
But you are actually a graduate of I don't know what the official term is, but the scope of practice
training.
And so I'd love to hear about your experiences with that. Like, how long does it take to become accredited or whatever the word is? Tell us all about it.
So just a bit of background for the listeners. If people don't know, the community pharmacy scope of practice pilot contains 20 different conditions that we can autonomously assess, diagnose and manage, including prescribing additional S4 medications that we didn't have access to. So it's a fully autonomous and with collaboration if the patient has pre-existing conditions with their regular doctors, of course. But I find that the conditions that were chosen were like so specifically designed and for presentations in North Queensland, because they did the studies with the most common presentations to ED that don't necessarily need to be treated in ED. It's the perfect types of conditions. So this includes, hormonal contraception, of course. We have a lot of traveling and backpacking patients that come around and need that service. Ear infections, skin infections, including shingles, impetigo, eczema, psoriasis, and otitis media and otitis externa are probably my most common ones that we see. In addition to that, the other services can include smoking cessation, cardiovascular health, and weight management, just to name a few. So there's 20 in total, but and of course travel.
Oh yes, travel. Tough to get travel.
One that we've done as well. So I've basically touched on most of them, I'd say by now, almost completing almost 100 consults so far.
Oh, wow. And what time is that? How long have you been able to do this?
We started this in April.
Wow. Yep. So in 4 months.
Yep.
Just under 4 months.
Yeah, those are the ones that are actually sit down and record with the closed door consultation that we've booked properly. This doesn't include on the floor consult and on the floor 5-minute brief interactions that you have that may or may not require further assistance, right? So we bring people in all the time to the consult room for various reasons, but even just pumping those actual proper consults and the pilot have been so rewarding.
Yeah, I can imagine.
How do we get to this stage?
Yes,
now,
might be you.
how do we get here? So it's a 2-part course currently. There's a prescribing component, which goes through all the background of assessing patients' needs and completing the prescribing cycle. So diagnosing and understanding patient history and coming up with a management plan and communicating that plan, doing that safely and effectively with all the different prescribing steps. Then you have the clinical component of the 20 different conditions that pharmacists do know. We know these things, but it adds another layer of complexity when people come in with undifferentiated symptoms that may or may not fit into your protocols. So a patient could come in with a cough, could be anything. They could come in with symptoms of reflux. They could come in with wheezing or shortness of breath. And it's up to you to do a full assessment and a comprehensive assessment, including physical examinations, then making up differential diagnosis that it may or may not be, then ruling them out, then creating a diagnosis. Then that's where the management actually starts. So once you have your condition, then pharmacists know, right, we know how to treat otitis externa. We know how to manage that appropriately. But it's getting to that point. There's a lot that we need to know and need to assess even before you start thinking about scripts. It's wild.
That's actually, I hadn't actually really thought about it in that way of, assessing it and all that pre-work almost before you get to that diagnosis. And traditionally people come in and most of the time they know what problem they have.
Exactly.
And so we're just treating that end state rather than trying to figure out, like they could be coming in, like you said, what they think, but maybe what they think is completely wrong. And you have to try and figure out that.
That's right. So even when, like as pharmacists, our job starts when we receive the script, when the diagnosis is, well, hopefully been made accurately. But now our job is making sure that it's nothing, no red flags are present, and giving you the responsibility that that's your patient and you're looking after them holistically. What am I trying to say? The responsibility that you have, the duty of care that you have to that patient is significantly increased. So you want to make sure that what you're giving them is right. You really have to be thorough with your assessments.
Yeah. And so has that been difficult in, it's almost changing the way that we approach our patients, right? And even the conversation, it's almost, and I haven't done the expanded scope training, but I've always thought that pharmacists were really great at counselling, but consulting is something completely different. So
it's a whole new ballpark. So basically, we're asking questions, and it's changed the way that I've practiced completely. Because I'm saying one thing, and I'm asking them questions. In the back of our minds, we're thinking, okay, it's not fever, and it's not meningitis, and it's not SJS, and it's not this. But you're asking these questions, and you're automatically trying to rule out other things. So I describe it when doing the training as it's almost like learning backwards to what we thought that how this would go. So you have to sort of relearn. So coming from a pharmacist's perspective, it's quite tricky to unlearn certain habits and relearn them different ways. And it's just given me so much more respect for the GP profession, the doctor profession, and the prescribing professions, because they're doing these things that we had. So they consider so many things that we didn't. And now we have to. So
that's really great. And I think the fact that you said that, you've now, I know you personally, so I know you have great respect for GPs and other prescribers, but understanding what they have to go through.
There's a lot of work.
Yeah. Now I understand why they need to study for as long as they do.
Definitely.
Considering we're just doing just under 30 conditions.
Yeah, exactly. And it's not more what the condition is, it's what is it not.
Yeah.
So the amount of tests or blood tests or assessments that you have to learn, it's completely valid.
Yeah, absolutely. That's really cool. So I think if anyone is, interested in being an expanded scope of practice pharmacist, yeah, it sounds like the road to get there, it's not necessarily easy.
Very challenging. I can talk to you a little bit more in terms of what else is required.
Yeah, that'd be great.
So during the coursework, you have like assignments and lectures that you sort of attend, but you also have to do supervised hours by a registered prescriber. So you have to work under their supervision in terms of, I had to do 120 hours of logging cases and conversations and making sure that they're mentoring you for what's relevant in your scope, right? I found that quite challenging to find a designated prescriber because that's a lot of time and effort to put into someone. So I was lucky enough to find someone external and we could communicate virtually and talk about our experiences. And we did that every week or every fortnight for months on end. And I would log activities or log cases that I had at work. And I would say, okay, well, if I was the prescriber, I would consider this, 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 and this, and my management would be this. And then she basically would say, did you consider this? Or would you do this? And she goes, why didn't you consider pancreatitis? And I was like, oh, clearly it's pancreatitis, obviously.
I was testing you, right?
Yeah, like, well, I didn't even think to do that. But do you know the one that gets me every time? And I wrote a big thing about it. It was, I've just got some nausea, just nausea. And asked all these questions. And I was like, I've asked all the questions. I still have no idea what it is. So what do you do? And she goes, and I go, well, what blood test would you order? And she go, okay, we'd check their thyroid. We'd check their iron levels. We'd check their B12 levels. We'd check if they're pregnant. We'd check all these things that you wouldn't really necessarily think of straight away.
And also, like just using that example of nausea, like that traditionally when people come in with nausea, it's kind of like a minor ailment, as people call it, and you're treating that symptom. But nausea can manifest because of a number of different reasons, and like you said, you've got to try and figure out what it's not and what could be causing it. It could be anything.
So all of a sudden, we're not just treating the symptoms; we're treating the person, we're treating the patient. So you have to get to the bottom of it almost.
Yeah,
and you have that responsibility.
Yeah, exactly. But I think that's really exciting, and it helps us to almost step back and take that extra time with the patients as well. Like you mentioned that it's completely changed the way that you practice. And so do you find that from this new training, it has changed the way that you just address normal OTC requests
absolutely.
as well?
Yep. So I'm already asking specific questioning. And when people present with a rash, like you can stand at the dispensary and sort of look at it. I am getting down on my hands and knees and I'm examining that rash so specifically in terms of the configuration and the color and the onset and taking into consideration all their social history factors. And really, I even describe it to the patient. I said, okay, so I can see that it's got a demarcated border and there's some inflammation present and minimal discharge and it's not itchy and you don't have systemic symptoms. And because of these reasons, sounds like you may or may not have this. Rather than people going, I've got eczema. I'm like, do you though?
Do you though?
Yeah. And you'll be surprised of what people find out with their social history too. So there's always a reason. If you give patients 2 minutes to just tell you stuff, you'll be so surprised what they say. They taught us at prescribing school, I call it. Pretend to sit on your hands, zip your lips for 2 minutes and let them talk.
That's actually brilliant. And you've just triggered something because my husband, he is a police officer and we quite often chat about how he interviews people. And he said the number one technique, and hopefully I'm not giving away any secrets here that I'm not allowed to, but anyway, he says that they just don't say anything. And I'm like, but what do they say? Like, you'll be surprised at what people say when you are silent. So that, when you mentioned that, I thought, I feel like as pharmacists, we're traditionally trained. We're very like, let's get all the information out and ask a lot of questions,
and sometimes they don't know it straight away. You have to give them time to think. And I even say that in my consults, and I do this very intentionally. I say, I'm going to type some notes now and give you a minute to think. If you have any questions or anything else you want to add, please feel free. And I intentionally type, and because that gives them a time to really think. And they go, oh, I forgot to say this. Or if you ask them a question, they might not know straight away. And you give them 30 seconds and it's hard not to jump in with your answer because you want it to speed up. But they're going, am I pregnant?
Yes.
And they're like, and they're thinking, they're going,
Literally.
when was my last period? And they like get out their phone and everything.
Yes. Well, that's so true, right? Like, because, yeah, you do need to give them time to think.
Of course, yeah. So you can't rush.
But what about when, say, someone's coming in and they just are expecting quite a quick transactional approach? How do you differentiate between just a OTC encounter and then actually transitioning them to participate in the service?
Correct. That's a good question. So the trick is here, and also training your staff to do it well and your interns to do it well, is what I call taking a brief history. So it's getting out key information, a few topic sentences to determine, well, number one, eligibility. Number two, is the patient willing and accepting for this type of care? Because some people just want their next EM in to go, right? Which is fair enough if they make up to their decision making. And then so they ask a few questions. Okay, is your ear okay? It's blocked. Is it painful? How long has it been there for? Great. You may benefit from having a sit-down consult with the pharmacist. Would you like to do that? And they go, oh my God, what? You can do that? Every time. And they're like, yeah, we've got an otoscope camera and we can do examinations.
That's so
And they're
cool.
like, what? A lot of the times they will say no, but sometimes they'll say, oh, I've got to be on my next bus tour in 2 minutes.
Yes.
And I'm like, okay, I don't need to see you. It's fine.
Here's your next EM. See you later.
Literally. So you've got that first brief interaction. You've got 1 minute basically to decide. And also in yourself as a practitioner, what else is happening in your day? You've got vaccinations over here. You've got a broken arm over here. You've got 6 scripts over here, webs to pack over here. You've got to balance your time appropriate too. And you say, okay, well, unfortunately, I don't have time to see you right now. Would you be available for a consult this afternoon?
Yeah.
Book them in for 2 p.m. Book them in for whatever. Your time is worth money now. They go, can I see the pharmacist? So I go, do you have an appointment? Literally though, but, it depends on the topic, and you've got to be quite good of how you can triage your time. So it's our crucial role as a pharmacy and as a pharmacist now is triaging these primary conditions even more than what we did before, because we can't fob it off to the doctors because they're not going to see anyone. You can't just say, I'm too busy. That's not an excuse.
Yeah. Yeah. I love it. Yep. Okay. End of discussion. Just went up. Yep. Love it.
Yeah, literally.
But you also mentioned, not only are you being a prescribing pharmacist, but you've got your day-to-day job as well, right? And that can probably come with its own challenges as well. So I'd love to find out if, well, I'm sure everyone faces challenges, just sometimes we just don't talk about them. Have you dealt with any challenges in the pharmacy or professionally that you could maybe chat about today?
Yeah, of course. So this is tricky because upon taking on this prescribing role as a managing pharmacist and a partner in the business, I actually look after 3 stores.
Oh, wow.
And so we've got to make time to talk to all our staff members, participate in organizational management. You've got to find time to do the rosters. You've got to be a pharmacist. So do you know what my trick, and I tell people now, is it's the best thing. Just wear a different colored shirt. So then you know, and other people know what you're doing that day.
Yes,
So
I love
this
that.
is my consulting shirt. I do consults mainly on Mondays and Tuesdays, or other days only if it's really urgent. So then they come in, they go, oh, you're a pharmacist today? Great. I'm going to ask you about this OTC question. Or if I come in a corporate shirt, I just be completely transparent. I said, guys, today I'm working on rosters. I'm going to be sitting in the office or whatever. Come and talk to me about these type of things.
That's it's a simple, really simple thing, but that would be really helpful.
And I know, and everyone else knows what you're doing. So they're not trying to pull you in 50 different directions. You've got different hats. Literally wear different hats or different shirts.
Love
and
it.
I go, this is my Friday shirt, actually.
Nice. But yeah, you're right. Like that communication is really important. And because we're going to be doing so many different things now, like we really have to be organized as a team and communicating on whose role is what and what they're doing, what their responsibilities are.
And your assistances are so vital in this. So keeping them in the loop, keeping them up to date with their training with QSVP, but also extended scope assistant training is available.
Yeah, I have seen that. So assistants can now actually do some training to help support as well.
Yep. So they become your receptionist. They become your first point of call before the first point of call.
Yeah. Yeah.
So,
The first one we called before
Yeah.
that. Yeah. Because,
Because-
you're right. As much as we would love to say as pharmacists that we speak to every single person walking through the door,
Yep.
we're not the first people that they see. It's the assistants. And so you mentioned before having them being able to triage.
Yeah. Or
to-
even then as well, for an example, a lot of people skulk around the store and they teach us at prescribing school. They come in for something, but they actually mean something else. So they have, or they don't have the confidence, or there's something that's on their mind, but they're not brave enough to say it. You could have that person lurking around the fragrances, but really she's actually after the morning after pill.
Yes, I love
Do you not get that?
lurking. Yes.
And then,
yes.
so it's up to your other staff, because you're obviously on the computer, on the phones, you've got 50 things happening. They walk in the front door, the assistants greet and acknowledge every patient, because that's what we do in pharmacy. There's no pharmacies that don't greet and acknowledge their patients, right?
Yes, definitely.
As soon as they walk through the door, you greet them politely. They're going to say hi to them first. So they may give them the confidence and, yes, I'm buying this fragrance. Oh, but actually, do you mind if I can try and talk to the pharmacist about this?
Yeah. And you're right. They do lurk around.
But they see it as soon as they come in.
Yeah. And it's like, no, they're not trying to steal something. They just want to speak to the pharmacist.
Yeah. And even in consults, right? They could be coming in, for example, hormonal contraception, and they talk about the pill, but what they really need help with is their sexual health, or what they really are having trouble with is it in the back of your mind is this a risk of DV, domestic violence, or is this a risk of, are we trying to pick up things that they're not telling me? Is it depression? Is it thyroid dysfunction? Is it anemia? Did they come in for their chest infection and yet the teenager has blaringly obvious horrible acne, and then they're saying, oh, but look at this thing on my toe. You know what I mean? But then really they want to tell you something.
It's giving them that opportunity to...
I say this every time before I go back out. So at the end of the consult, I've written the script or whatever I'm doing, and I sit there and I go, okay, before we go back out into the wild, because we'll get interrupted out there, and I've got a closed door with you now, is there anything else that you really need to tell me today?
That's a really nice way to say it.
Totally, because then they have closure. Because the worst thing is if you finish an appointment and you don't feel like you got out what you wanted to get out of it.
Yes.
They could be trying to say this thing the whole time during the whole consult, and then they go, actually, there is one more thing that's really bugging me on my mind. And you go, I'm glad you told me, because we wouldn't have had this time.
Yeah. And now I understand why, sometimes when patients will come into the pharmacy and they're like, oh, I forgot to ask the doctor this. And you're like, what do you mean you forgot to ask?
You were just there. Yeah.
Just there.
But then they think of things afterwards, or they think of things during it that they weren't brave enough to say. So
exactly. That's right. So it sounds like you've been pretty busy with not only looking after the 3 pharmacies and then becoming a prescribing pharmacist. I bet you probably need to have a good support network around you to be able to do this.
Yeah.
And I think, like, for me, like studying business and studying and doing all this stuff, I'm so lucky to have, a partner that is so supportive and can help pick up the slack at home. And so how do you kind of manage that balance? Yeah. Who's your support network?
Yep. So I do have an amazing partner. We've been together now almost 10 years. Can you believe
it? Wow. What? That doesn't seem, no way it's been 10 years.
Almost.
Wow.
So me and Matthew, we've been together for a long time. He's literally been my absolute rock. So he brings me down to earth sometimes when I go on these amazing pharmacy land tangents. And the day-to-day work as a partnership with your partner, you've got to do the washing and the shopping and make time to do activities separate from your business work. So we do a lot of beach walks, we do a lot of adventures. Every year I promise him to do a overseas trip of some description. So that's our thing. And we always have something planned or something in the works to plan that. Apart from my partner that I come home to every day, I've got really good friends outside of pharmacy and also inside pharmacy too. Because I live and work with the people that I live and work with, sometimes it is difficult. So I've got lots of friends across all Australia now, being in the pharmacy industry for feels like a long time, like yourself, that we catch up occasionally at conferences that you see, and friends within my company, within Live Life. We've got such a strong bond with the other partners. We basically grew up together. So before I moved, we had a tight-knit group. After I moved, it's stayed the same. I can call them, phone a friend. I know they're in the same positions as me, running stores and getting the hard questions. So we actually call each other all the time. And even in the pharmacy and my staff members, I don't often answer my mobile phone, but if another pharmacy partner calls you, you answer.
Yeah.
Get what it is. And even just for a chat too. And then we morally support each other and say, okay, what are you doing outside of work? You talk about video games. You talk about other hobbies. I'm really into running at the moment. I've just smashed a new PB. So
well done.
Make sure you do other things to keep yourself sane.
I think that's so important. And yeah, especially I think, I don't know if it's all pharmacists, but most of the pharmacists I know, we live and breathe pharmacy, right? And it almost becomes our personality.
Yeah.
But so it is really important to make sure that you have that separation and go and do things outside of the pharmacy world. I know I find those moments really worthwhile, and having something to look forward to, like you mentioned about having an overseas holiday each year, whatever that is. I think when you know something's coming, something exciting, even if it's just something as simple as, I booked a weekend away or a staycation.
Definitely.
You've got something to look forward to then, so you're not just getting down in the daily grind, because it's very easy to just day by day sleep, work.
Even if it's a few hours too, I specifically have times I go, right, this afternoon, absolutely nothing to do with work. Even if it is 5 or 6 hours and that's it.
Yeah.
Sometimes that's all you need, but everyone's different, right?
Everyone's different. That's right. And yeah, I'm very much the same. I try and schedule in some times to separate work and life as well, which it can be tricky because life just gets in the way. But really making sure no, you know what? Yes, it's Sunday afternoon. I don't need to do anything else. I'm going to take my little dog for a walk and we're going to go get puppuccinos.
It's cold down there.
And maybe just watch some Kardashians or something when I get home, right? It's just to switch off. It's been an absolute pleasure speaking to you, James, and I feel like we could probably create our own series and delve into all these different areas that we've talked about. I think that would be quite fun. But is there anything else you wanted to mention, or any passing advice you'd like to leave for our listeners?
Yep. So I always come back to this. What would you tell yourself 5 years ago? Basically, keep doing what you're doing, making the connections, finding people that have similar values. Work hard. People often strive for recognition or to be the best that they can be. But my advice is work hard first, then the energy will come to you. So you know what you're doing. You love what you do. Opportunities come to that. Say yes to opportunities. When someone says, do you want to be on a podcast? You say, yeah, I do. Does anyone want to speak? Yes, I want to do this. Push yourself to grow and the rest will just follow. And make sure you find a good mentor.
Yes.
Yep.
Yeah.
People that believe in you and want to see you succeed. Just remember, you have to hang around the most successful people to become like them as well.
I love that. I've heard a similar thing where your inner circle, or the people that you spend most of your time with, you become like them.
It says you're the most average person in the 5 people that you hang out with. So if you want to be who you want to be, find people that are like that.
Yeah, absolutely. I think that's great advice. Well, thank you so much, James. I've really enjoyed our chat, and I hope all the listeners have as well. And I would love to have you back on the show again soon. But thank you. And I hope to see you soon.
Make sure everyone likes and subscribes.
Exactly. Thank you. You took my line. Thank you so much, James. Bye.
Thank you. Bye.
You've been listening to Your Pharmacy Career podcast, brought to you by Ravens Recruitment. Don't miss our next episode, where we continue to explore the multifaceted world of pharmacy careers. Make sure to subscribe and share.